Good evening, guys. So thank you for joining me. I am a little bit late, but I'm here. I'm going to be looking at two screens because I'm live on Instagram, which I did not start. So let's start that now. But I'm trying to do two different screens because I'm on live on Instagram and I am live on YouTube, Facebook, and LinkedIn. So if you are not connected with me there, please do. Most places it's all medical billing on Facebook and on LinkedIn and on Instagram. And it is Medical Billing Maven on YouTube. So most of you guys join me on YouTube. I hope to see you all tonight. Remember to leave comments, let this be an interactive live. I'm trying a different time because it is 6 p.m. Atlantic time. I usually do my lives on Saturdays at 6 sometimes. I've been doing at 2. I've been trying to just play around with the time to see what time is best with you. So I'm trying Friday at 6, but today has been hectic. And I'm hoping if it does stick that 6 o'clock is the time for Fridays, that things get better along the way. But we are going to jump straight into the video. So the video or the live today is going to be about making medical billing easier for you, the biller. And the way to do that is to decrease the errors that the front desk makes. Now, don't get me wrong, the front desk is not the only one who makes errors, and that's not the only reason why we get denials. But there are a lot of times that the front desk errors is the reason why we have mistakes on our claims and stuff. Now, if you cannot hear me, please put that in the chat. Let me know, because I'm using a mic as well, and I want to make sure that you guys can hear me. So I hope you can hear me. But so like I was saying, the front desk is a way that we can have errors on our claims. Now, before I jump deeply into it, my name is Tamika Duncan. If you don't know, I am a certified professional biller and practice manager. And I also have a shop that is www.itsallmedicalbilling.com. You go to the shop, you can pick up medical billing merch. And I also do remote one-on-one consultations. That is also on itsallmedicalbilling.com, and you can go to Consultations. So let's get that out of the way. But let's jump into some things that you can do, or you can help the front desk do, in order to decrease the mistakes that are going on with your claims. So I have some things listed. I'm going to be looking down to look at my list. Again, make sure you comment, engage. I want to know what you do to help decrease mistakes or errors at the front desk, because the front desk is a very important part of what we do as billers. And if we don't have the correct information, if things are not put in right, it makes our job harder than it needs to be. So I have 6 things that you can do to help decrease front desk errors or help decrease front desk mistakes. And the first one, and I put this one first because I think it is the most important, and that is to shift our mindset of the importance of the front desk. So a lot of times providers, billers, other people feel like the front desk is not that important. Like it's easy, their job is simple, or whatever you might use. And you feel like, or you make them feel like their job is not important. Again, they are the face of your practice. So their job is just as important as anyone else's job. Okay, the front desk is very important. So the first thing in shifting your mindset or shifting the mindset about the front desk is to don't belittle them. Do not make it seem like the front desk is not important. Now, I've worked for several providers who complain about the front desk, who say that, oh, they just have to answer phones. I don't understand why they keep making these errors. But they need to understand that the front desk is the key, the face, the start of everything. So do not belittle them. Now, I usually have like slides and stuff, but this has been a crazy day and I hadn't had the chance to do that. But I like to give points and I like to give information under each point. So the first point is to shift the mindset about what you think about the front desk. And underneath that is to don't belittle the front desk. The second thing is that, again, they are extremely important to the practice. When the patients make appointments, when doctors calls who refer patients, the front desk is usually who they get first. They usually don't speak to the doctor themselves, or they don't speak to the nurses or the MAs or even the billers. They don't speak to any of those people. They usually speak to the front desk. And if they're speaking to the front desk, then they are the most important people, because if you don't get the patient in the door, then you won't be able to do the rest of the job as far as seeing them, billing for them, collecting money, all of those things. You won't get the opportunity to do that if the front desk doesn't bring them in, pull them in. So they are extremely important to the practice. Then third, they are the face of the practice. Like I said, they are the face because most of the time patients remember the person at the front desk. So when the patient comes in, the person at the front desk may be like, hey, such and such. Hey, Tamika, how you doing? I see you came back for your appointment. Like, they make that bond. They create that relationship with the patient. So when they think about this certain office, they say, oh, well, such and such is going to be at the front desk. Now, I know for me, and I believe for all of us, we go to the doctor, whether it's for ourselves or for our family, friends, whoever, or with them. And you walk through the door, or you pick a specific doctor's office because you like the front desk staff. You like how they treat you. They make you feel comfortable. They make you feel warm, all of those things. So I know I choose specific doctors, not only for the doctor, but also for the front desk. Because if I don't like the people at the front desk, then I don't feel comfortable, so I don't want to go there. So I choose the people that, at the front desk that I feel comfortable with. Now, let me check to see if I have any comments. Sorry, got my computer in the way. I'm trying to maneuver this whole thing. But I know I choose people, or I choose doctors' offices where I have to feel comfortable with the provider as well as with the staff, okay? And especially the front desk staff. So under shifting your mindset, you don't belittle the front desk. You know that they're very important to the practice and they are the face of the practice, okay? If you have any comments, please leave them. I will be answering questions and, communicating with you guys as I go through my live today. But I just have some points, which I always like to do. I don't want to just come on the live and not have anything to talk about. But the second thing is to involve the front desk in understanding health insurance plans. Now, if you are already in the billing field, you know that there are so many different types of health insurance plans. And it's getting more complicated by the minute. Even today, I've been dealing with a specific insurance because I don't know for you guys, but for me, I've been noticing that, United Healthcare has been buying out all types of people. Like a lot of the different insurance, United Healthcare has global, and they have international, PPO, HMO, MCO, like they have Medicare, they have all types of insurance. So sometimes it's hard to figure out which insurance this patient has. You have to know the details. You have to know, you have to look at their age and where they work. And there's so many things to look at. So instead of you as the biller just being the one knowing everything about the health insurance plans, you need to be able to, whether it's you, and I keep saying you because I am also a practice manager. And so that is my job, to help teach and train and get the front desk on top of things. So you may not have to do that in your job where you work, but you should suggest it to your manager or to the office manager, because they may not understand how important they are in receiving payments for the organization. So make sure you help them to understand health insurance plans. Now, this would include changes in the health insurance plan. So again, there can be a lot of different changes throughout the policy year, or through each policy year, there can be changes, such as changes in copays and deductibles and plans in general. There can be changes. So the front desk needs to know that. You as the biller is not the only person who needs to know that. The front desk needs to know that, because they need to be the one to put that information in. You don't want for them to put the information in wrong every time. And so when it's time for you to bill, you're either getting rejections or denials because you have the wrong information in the system. And if you teach them how to do it the right way, not to say that they're not going to make any mistakes at all, but they will make fewer mistakes because now they understand what to do. Now, you also train them on the payers and their policies. So the same ways that us as billers learn about different payer policies and, what they have changed and not changed, there are some information that the front desk needs to also know. And they should be trained on this. This should not be something that they're just thrown into and expected to know, because that is when the errors are going to happen. One person might do it right, the next person might do it wrong, or they might teach each other the wrong way to do it continuously because nobody taught them how to do it right. So you don't, you want to make sure that you train them properly. When you train somebody to do something, you will get a better outcome than throwing them in the wild and expecting them to figure out what to do. That's where all the errors are going to come from. That's where all the mistakes are going to come from. And you also need to help them, which I think is extremely important, is to help them be able to read and understand the health insurance cards. Now, don't get me wrong, that's not the only thing that they need to understand, but that is the start of what they need to understand. So if they understand that if I see a insurance card that says PPO on it, then I can probably choose the PPO plan for that particular insurance. Or on the back of the card, where the biller would have to send claims, I need to choose the correct address that the claims need to be sent to, and that can help me choose which insurance company I need to choose in general. So there are many United Healthcares. So if they know they need to flip over the card, look at the back of the card, and the back of the card is going to show where the claims go, and I can kind of match that up with which insurance I choose and put in the system. Then that helps you as a biller have the right place that it needs to be sent, so that it doesn't have to be continuously being returned or rejected or anything like that. So you need to Give them samples or examples of different insurance cards. Let them know what everything on that insurance card means. You know, some of the insurance cards may have, you know, the effective date, the policy numbers, the ID numbers. Now, that's another thing that I see a lot of errors with. They don't put in the right ID number because they're not sure which number is the right number. Depending on what card it is, you have to know where to look to put in the right ID number. So making sure that they have the correct ID number. Oh, sorry, Instagram. Making sure that they have the correct ID number will be helpful for you too, because now you as a biller won't get these rejections for simple things as ID numbers. Also having the correct the name spelled correctly, and, you know, not putting on a nickname, making sure that if the patient, let's say the patient got married, but they didn't change the card to their married name, making sure you leave the maiden name, or maybe hyphenate the name so that the insurance can know who you're talking about. So I've had many instances where a patient came in, they were initially, you know, Tamika Williams, and then they got married and they are now Tamika White, and the card still says Tamika Williams though. And so you ask them, do you have a new card? You know, we need to put in a new card, and they're like, no, I don't have a new card, but my name is Tamika White and I want my name to be Tamika White. Now, by all means, we want to put it the way the patients want us to put it. But if we put Tamika White, we may end up getting a rejection because the insurance would say that's not the correct name of the patient. So what I normally would do, I would either first let them know, well, I can't, you know, until you get that corrected through your insurance company, I'm going to leave it as Tamika Williams. And then you can come in, bring us in a new card, and I'll change it to Tamika White. But you always have that patient that is like, no, I want to change. And that's, you're going to tell me I can't change it. And, you know, they go into all of that. So I have just put Tamika, I would put Tamika Williams White. So it'll make them feel good, and then it will make us not get our claim rejected. You know, just try to please both parties in this way. So I usually do that. So those are the three things you need to make sure that they know about health insurance plans, because they deal with it every single day. Now, you would think that because they deal with it every single day, that they know which ones to choose, they know which ones not to choose. But a lot of times they don't, because what they're doing initially, they're putting in the health plan information, they're doing all of that. And they're not seeing, though, the back end of it. They're not seeing that this claim is getting rejected, this claim is getting denied. They're not seeing any of that unless you tell them that, because you as the biller need to let them know the errors. And I'm going to go into that in my next set of points. But you as the biller, you need to let them know what they're doing wrong, what's not right, why it's not right. You need to inform them of all of that. Okay, so, and I had another point that I was going to think of, which just totally slipped my mind. But the main thing is you need to teach them about the health insurance claims themselves. It is very important. It is the main thing that they do. And if they are trained properly on it, they will make sure that they get it done, you know, better. So the third thing that you need to do to make sure that you decrease the errors of the front desk, and that is to show them how the claim form looks and where their part is so important on the claim. So if we are billers, and I was supposed to bring a claim form, you know, things happen. But if you're already a biller, you know what the claim form looks like. And on the top part of the claim form, that is where all the information that the front desk puts in, well, not all, but the majority of the information that the front desk puts in is on the top of the claim form. And you need to be able to show them where the information that they're putting in the system is going to go on the claim form, and then let them know how important that information is. So if the date of birth is missing, if the ID number is missing, then it's not going to be in line such and such, and the insurance is not going to pay it because they're not going to know who it's for. Explain all of this to the front desk so that they won't, they will feel like their job, which it is, not even feel like, but they would know that their job is important and that they need to have this information filled out and ready to go for the claims. Because if they don't, then you can't send the claims. Let me drink. When I talk so much, my throat just easily gets really dry. But so you connect them. You're basically, what you're doing is you're connecting them with the claim form. Most front desk people may feel intimidated by the claim form. It's like, I don't even know what this is. It's just a big red form with all of these numbers on it, and they don't know what it is. But if you sit down and you show them what each box represents, why it's important, how they play a role in filling this information out, it will connect them to the claim form, and they will do better when it's time to fill it out and fill in the right information, because now they know what information needs to be there. Then you just, okay, I think I said that you give them a relationship with the claim form, and that the top half belongs to them. Like I said, all of this is to say, give them a bond. Let them have a relationship with the claim form. Hi, Peggy. I'm glad somebody else decided to talk and tell me hi. Yes, thank you. I really think this is important. And I wanted to do a live about this because I find that too many billers complain about the front desk. And it's always, oh, the front desk did this and the front desk did that, and they don't listen. But you have to train them. You have to make them understand why it's important. And most people, and this is with any job, not just with the front desk, with billers, with whoever, you can't throw somebody in the wild and expect them to know what to do. You have to train them, make them understand their role in it, how it plays a part in the whole scheme of things. Because again, billers are not doing all of this on their own. We don't, yes, we're the ones at the last part of it, I guess, to get things paid. But in order to get paid, we have to have the front desk staff. We have to have, nurses and MAs and people to triage the patient. We have to have the doctor. We have to have the coders. If we, if the doctor's not coding, we have to have coders. Or if we're the coder, we have to code. Like, there is that's why it's called the revenue cycle, and that's why it's a circle, because everybody works together to get this one thing done. And definitely, Peggy, communication is key. It is the only way. It's the only thing. And the funny part about that is it sounds so simple, and most people say that, but most people don't do it. And most people assume things. They assume you're supposed to know. They assume, you should know this, and they think you're gonna, what's the word I'm thinking of? But they think you can read their minds and figure out what they want to say. No, that's not how it works. You need to be able to speak and communicate and let people know what it is that they need to do, what you expect of them, and how they play a role in the practice, because everybody, again, plays a role in the practice. Now, the fourth way is to communicate with them not only about errors. So that's a part of what you said, Peggy. Like you said, communication is key. But as billers, right, sometimes we have no relationship with anyone else as far as like the front desk. We might talk to the providers if we need to ask a question, but we don't really like mingle with everybody else. Now, I always have to mingle with everybody because, again, I'm the office manager as well. But sometimes if you're just a biller, because when I was just doing billing, I found myself to just kind of be in my little room, my little corner, and I was just getting at it. Like I was just going away with all of that. But you have to get out there. You have to talk, communicate, do everything with everybody else. So first and foremost, I think we need to praise the front desk when they're doing well. Stop blaming the front desk all the time for all these mistakes. And especially if they are not trained and you're not showing them what to do. Stop blaming them. So when they're doing something right, if for some reason, let's say when it comes to Medicare Advantage insurances, they kept getting all these errors, they kept picking the wrong ones and just sometimes putting in the original Medicare and not the Advantage plan. And they was just messing up everything. But you went to them, you cleared it up, you let them know, you gave them a little training. And then a month or two after, you noticed that the errors decreased. You don't have to keep changing all the time. You're not getting rejections or denials, none of that. I think it's important for you to then praise them. Let them know, great, I see you've been listening. You've been, have any more questions? Is there anything you need to know? Let them know that you see what they are doing. I'm over here chatting, and I think I have a question on Instagram. This is why I can't do two at one time. But the front desk is the face of the office, and they are valuable to the billing process. Elite medical billing. Yes, elite medical billing. That's what I was saying earlier. They are definitely the face, and they are very, very important to the face of the practice. It's just what it is. They are very, very important. And so after you praise them, like I said, you want to praise them for what they're doing when they correct their errors. Praise them. And anybody would want to be praised for doing the right thing. If they start doing the right thing and notice that you don't even care, then why will they continue to do the right thing if you're not going to praise them? Also, talk to them about the insurance troubles. So, like I was saying earlier, normally the front desk does whatever they have to do in the front, put in the demographics, put in the insurance, do all of that. And then they don't make the connection because they understand that we get paid for a claim, but they don't make that connection because they don't probably see us posting payments and calling patients for collections and doing AR and all of those things. They don't see that. So they don't make that connection. But what I try to do is when I start to see that there are things that, let's say I notice Blue Cross Blue Shield, let me use this one for example, United Healthcare. So I work for OBGYN, and for Cigna, the OBGYN is considered a specialist. But for United Healthcare, they are considered PCP. What does that have to do with the front desk? It has to do a lot. The first thing is that when the front desk charges the patient, they need to know if they're using specialists or if they're using PCP. Now, if I just continue to let so when I found out, okay, this is how the providers are credentialed, I need to let the front desk know that. And I need to let them know why and what that means and all of that good stuff. Maybe I might not have known that initially, but now I do. I need to pass along that information to them. So what do? I have a little training. I let them know, okay, so United Healthcare, I found out that we're credentialed this way, and you need to start charging only United Healthcare patients as PCP. Everybody else is specialist, blah, blah, blah. But again, you let them know so that when we talk, we have something that we can connect with them. We can bond, we can talk to them. It's not like we're billers and we're over there and they're front desk staff and they're over there. No, we can bond, we can connect. So I can go up to them and talk to them about insurance and talk to them about, oh my gosh, they didn't pay this, they didn't do that. I can bond with them. We're not on two different levels. We are together because we should work together. And third, we need to talk to them on their level to connect. So us billers sometimes have our own language. And, as billers, we be out there talking to, and like how I just said, and the PCP and the copay and the co-insurance and the out of pocket, like we talking all of our language. But sometimes, again, the front desk gets intimidated because it seems like a lot and they're not familiar with it. So when we come to talk to them, we need to talk to them on their level. Now, this is not to make them feel as if they are slow or they don't understand. I'm not saying to talk like that. But I'm just saying, don't stop pitching out all these words and then they don't know what it means. I noticed for myself what I try to do, because sometimes it's not intentional. It's just the way I talk because it's what's going on and that's what I'm accustomed to. That's my profession. That's what I'm used to. So if I start saying like, so the copay and this, that, I mean, they by now know that because I've explained it to them. But if I start to say stuff like that, I'll pull back and say, oh, okay. And copay is a set fee that's da-da-da-da-da-da-da, and then continue with my conversation. Like I kind of do a little training and learning as well. Again, some of you may not have to do that because you might not be in that position to do that. But I would, if I'm not in a position necessarily to do that, I would suggest it to my supervisor or to my manager. Let them know, but especially in small practices where you can be able to talk. And that's where I have all of my training from. It's small practices. And so the staff is usually close and we usually bond, and I can go up to them, go meet them to the front, whatever, and we can talk. So Peggy says, praise, yes, is a great tool to let them know they're doing well. Yeah, and everybody wants to be praised. No one wants to continue to do things and feel like they're overlooked and that no one cares that they're doing the right thing, especially after you, talk down to them or like, oh my God, you always messing this up. You always messing up. When they're doing something right, let them know they're doing it right. So then they'll feel better. They want to do better. They want to do it more, all of that good stuff. Now, the fifth thing is to empower them to ask questions. I used to have not a doctor, but someone that I worked for. And he used to tell me, this is when I was like 20 years ago, probably 22 years ago. So I was about 20 something at the time. And he used to always tell me, oh, if you have a question, ask. And I feel like, I don't know. Like, first, number one, I used to be kind of scared to ask questions because I was like, oh my God, is this a dumb question? Is this like, should I already know the answer to this question? So I used to feel a little intimidated to ask questions. But as I got older, I learned that the only way you're going to learn is to ask questions. And everybody needs to ask questions. There should be no embarrassment in asking questions. Now, I don't care how old you are and what people think you should know. There's no embarrassment in asking questions. So as a biller, you need to help the front desk or empower the front desk to ask questions. Now, I know sometimes it can get maybe a little annoying, especially if you are in between doing something or whatever. But I think the more questions that they ask so that they can get it right, let them ask it. And I would say, which I always tell people too, because, sometimes I've been told that I can be a little harsh, but it don't be trying to be harsh. But I always tell people that I don't mind training you, asking me all the questions you need to ask. However, if you learn visually, you need to do it visually. If you learn by watching me do something, then do that. Watch me do something. You might not have to write it down. If you learn by writing down, write it down. Like after 2, 3, 4 times and you keep asking me the same thing, then you're not retaining it the way you're supposed to. Like maybe if you're supposed to write it down, but every time you ask me, you just say, oh, okay, and then you do it and then you forget it, now that's your problem. You know, like now you have to know how you learn. Everyone doesn't learn the same. So I don't mind you asking me questions, ask away, because asking me questions is gonna help you as well as help me. Then it's all good. Ask away. Okay. So empower them to ask questions. Be open to teach, like I just said, which I like to teach. Not everybody likes to teach, but I mean, you have to be able to tell people what they need to do. And it's not necessarily like teaching like A, B, C, D, you know, anything like that, but you just need to be able to teach them things that they need to know. Allow them to ask questions and not feel intimidated or not make them feel bad, like, oh, you should know that. And I told you that already. Don't make people feel bad. Let them be able to ask the questions that they want to ask. Also, lighten up. Make it something a little, don't make it so prim and proper, is what I would say. Like again, when people talk to me about medical billing, some people are so intimidated with billing. Like, I don't know what to do. I don't know numbers. I don't this, and they get really scared or intimidated. Make it fun. Billing can be fun. Billing can be frustrating, but billing can be fun. So don't be so prim and proper. Even if you have to give it to them or explain it to them in a way that is a fun way to do it. I even sometimes, like, I might give them, which I don't want to, let me not go into that because that's my next thing. But I usually try to make it fun. Don't make it so stiff and, you know, it's like, oh, you need to do this and you have to, and you have, because in medical billing, if anybody knows, and I know you guys know, medical billing is so gray. Like, there are barely things that are black and white in medical billing. So even if you give them a straight set of rules to follow, probably like 40% of the time they can't follow that straight set of rules. So let them know that there are going to be exceptions to these rules. There are going to be sometimes you might have to do something else, think outside of the box, all of that stuff. But let them know, try to make it fun for them. Don't make it so stiff and, you know, just serious and, oh my God, you didn't take a copay. And, oh, you took a copay, but it's the wrong copay. It was supposed to be the specialist copay. And just try to explain it to them. Make it be fun for them. And last but not least, before we get into the question and answer section, is to show them how to do it. Don't just do it. I am a person who wholeheartedly believes in how it goes, showing a person how to fish, not just giving them a fish. I think that's how it goes. But you have to show people how to do it. Empower them to want to do it for themselves. Because if you continue to do it for them, you know, I've also seen in a lot of these practices, something would go wrong, you know, let's say, like our example, the front desk put in the wrong ID number. And so when it goes to the insurance, it's rejected. Now, instead of you just changing that insurance ID, and now, if it happened once, you might let it slide. Okay, that's cool. We could live with that. But if you could start seeing a pattern, I would then not change it automatically myself. I will go to the front desk, let them know, okay, I keep getting a rejection for this, and this is what you need to do. Show them where to put it, why they need to put it there, where they need to look on the insurance card. Let them know all of that. Doing it on the back end without helping them it's not helping them. So they're going to continue to make that same mistake over and over and over again. On Instagram, okay, hi. Are you working this full time or is this a side business? I am working full time, and I wouldn't call it a side business. I would call it a business. So yes, to answer your question. Working front desk is very stressful and fast. Oh, girl. Listen. Okay, so again, as the office manager, I have to sometimes fill in for the front desk. Like right now, actually, in one of the practices that I work for, or in the practice that I work for, we are learning a whole new system. And so it has been very hectic. So the young lady at the front desk she's busy. She's, a lot is going on. And I have to jump in and help her. And for probably 3 days out of this was the beginning of the year, 3 days I had to be in the front, working the front. So I was working the front for the most part. I wasn't even really doing any billing. And when I got home, I was so tired. Like I was like knocked out. Like I got home at probably like 5:30, 6 o'clock, and I was asleep by like 8 o'clock. I was tired. The front desk can be so fast paced, and depending on where you work, what's your specialty. Let's say you like work in the ER, or with us, we work in the OBGYN office, and we probably have about 25, 30 patients in a day. But it was crazy. I was so tired. And I don't think people realize how fast-paced the front desk could be. You got to answer phones. You have to put in the information. You have to talk to the patients. You have to tell them about the money and collect money and fax things and get labs and call the other doctor's office. Like you have to do so many things. You have to multitask. If you're not a multitasker at the front desk, you're not going to last. You're not going to last at all. I'm a hospital medical biller and follow-up team for Medicaid manage. I am an employee. Oh, okay, that's great. Yeah. So I know a lot of people who, and let me not say a lot, but I know some people who do the Medicare, manage Medicare. I do a lot with all insurances. Where I am in the Virgin Islands, we don't have we have Medicare Advantage, but that's mainly, and we have the original Medicare, of course. But we don't have as many different types of insurances that you guys have. Hi, Tamika. How do medical billers have quotas to meet for the amount of claims they work? Oh, do medical billers? Sorry, I don't know where I was reading. Do medical billers have quotas? So I can't tell you that for everybody, but as for myself, I've never had a quota. And I think that's because I am billing for small practices. I'm the only person billing, and it's for a practice. Maybe I'm thinking that would maybe pertain more to hospitals, because if you notice, billers in the hospital and billers in practices, they sometimes do different things. And hospitals usually have more strict rules, more structured rules. So I think it depends on where you go to work. If you go to work at a hospital, you may have a quota. You most likely will have a quota. If you work in a small practice, you probably may not. But if you get in a practice that maybe has more providers, maybe let's say they have 5, 6 providers, 7, 8, 10 providers, then you may also have a quota in that job. So I think it just depends on where you actually work. See, over on Instagram, she's saying that she has a quota to meet 50 claims per day and doing follow-up. So like I said, and she works at the hospital. So hospitals, I believe, would have quotas. Practices, like I said, I've worked for several practices and I've never had a quota. My quota is get my work done. I know what to do. I get it done. How I usually work is I just, I go through the day's patients, make sure that I get them all out. Now, all of that, and I don't know, we can maybe do a video on that, but that too is very different. What I would like to let people know, and I always try to let them know, is that this job or this profession of being a medical biller can go lots of different ways. There's no one way to do anything. There's no one way that a specific company works. You may go to one doctor's office and you have to do it this way, and they want this amount. Like you said, they might want a quota. And then you go to another doctor, same specialty, maybe even have like around the same amount of patients, and they do it a whole completely different way. So that's one thing I like to tell people, is that don't let anybody fool you to think that it has to go a specific way, or it's always this certain way, because it definitely is not always the same at all. So the last one which we were on, let me just get through that and then we could talk a little bit more. But the last one that we were on was to show them how to do it, and don't just do it for them. So show them relatable examples. So when things happen, tell them, oh, remember Jane Doe when she had this type of insurance and this was the card she had and you charged her this. And so let them kind of like, again, relate to that. So they know Jane Doe. They probably know Jane Doe better than we know Jane Doe, because we don't really deal with the patients like that. They do. So when you kind of relate that to them, they say, oh, okay. And not only Jane had that insurance, Shauna had that insurance. And then they can relate that and say, oh, well, okay, I did it this way for Jane, so now I have to do it this way for Shauna, and I need to do it, for these people who work here or do that. Like, have them relate the information that you give them, show them examples. And the last thing that I do is I try to make it fun. Again, I'm the office manager, so when I'm training them and stuff, sometimes I do quizzes. I do, okay, we're gonna do some quizzes, right? We're gonna do some quizzes up in here, and we're going to, whoever gets the most correct is gonna get a lunch, or just again, make it fun for them. Have them engaged, let them know their importance. All of these 6 things that we went through, and I'll go through them again just in case you guys missed some of it. It was to shift the mindset of the importance of the front desk. That was number 1. Number 2 was to involve the front desk in understanding health insurance plans. Number 3 is to show them how the claim form looks and where their part is so important. Number 4 is to communicate with them not only about errors. Number 5 is to empower them to ask questions. And number 6 is to show them how to do it, not just do it for them. So if you incorporate all of those things with the front desk, I guarantee you it's going to work, because I've done it several times and it has worked. Like the staff that I have now at my full-time job, I love them. And if they're looking at this now, know that I love you guys, because sometimes they even bring things to me. They show me things because I have helped them to feel so comfortable to ask questions, and even sometimes like the MAs and the nurses, they don't really have to deal with that, but sometimes I even include them. So when they might be out there taking appointments, they understand, they know. I might tell them, let's say about medical assistance or Medicaid. We call it MAP here in the Virgin Islands, but I tell them about that. And, they say, oh, well, okay, I remember Tamika said we don't take it for this. We don't. Involve them. This is not just about you. And it will help you in the long run. When it's time to send out your claims, when it's time to get things paid, it will help you definitely in the long run. Okay, let me see if I have any more questions. Okay, is it hard running a medical billing business as a side business while working full time? What are my thoughts? If it's hard, it is challenging. I guess I would use that word. And I wouldn't necessarily use hard, because I think I love it it is challenging. Let me use that word. It's challenging to have a YouTube channel and have a business and work a 9 to 5 and do all the things. But I love billing. I don't know if you guys can see it when I talk about it, but I love billing. I can talk about billing all day. I just came from work where I was doing billing all day to come home to do this live, talk more about billing, to then go and do more billing. So it is something that I really am passionate about. And I think that is why I continue to do it. And that's why I even, because no one, how I want to say it, no one told me that I need to have a business, work 9 to 5, have a YouTube channel. Nobody told me that. That's something that I decided that I wanted to do. And I wanted to do it because, again, I'm so passionate about it. That's why when I speak to people who, say, oh, I want to get into billing because it's going to make me all this money. And it kind of annoys me because it's not just about that. Like I believe an advocate for patients. I do that all the time. And I remember the doctor that I used to work for, he used to tell me like, that's not your job to advocate, but it's my job. It is my job. These are my patients. They were his patients, but they're my patients too. Like, so I advocate for my patients as well. So I love what I do, and it can definitely be challenging. Do not get me wrong. I don't want to make it seem like it's a walk in the park, because it definitely is not. And I think I see my sister on here, so she will tell you, if she would speak up, she would tell you that it is not a walk in the park at all, but I love what I do. So that's why, I do it. She says, okay, she says she's an advocate for patients too. I love what I see. And that's the thing. If you love what you do, let me not even use that quote, because I'm not going to try and use that. They say, if you love what you do, you will not work a day in your life. That's a lie, because I work every day, or mostly every day. I try and take off Sundays, but I work mostly every day, and I work. So, and I love what I do. So that whole thing about if you love what you do, it won't be, no. But if you love what you do, it will keep you going. It will sustain you. It will motivate you to keep going. So when you want to give up, when you want to say, oh my God, this is too much, what am I doing? You will then be able to pull back and say, I love this. Like, I'm doing it because I love it. That was a great question. Yes, that was a great question. Tamika, yes, that was a great question, because like I said, I don't know. People, I find that people just make things seem not how they appear. And I really don't like that. So I don't want to keep y'all too long. We're almost hitting up on an hour. I can probably stay about 7 more minutes or so. If you guys have any questions in reference to what we spoke about the front desk, if you're having any problems, I had someone email me asking me about verification or eligibility, because she said she's the biller, but the front desk doesn't know anything about verification and eligibility. So I suggested to her, well, I did a video, and I'm gonna link that. So I did a video about that. So if y'all didn't see that video, please do. If you're on YouTube, because it's a YouTube video, I'm gonna link that above. But you have to train the staff. If the staff doesn't know how to do verification and eligibility, that is the practice's fault. That is not the front desk fault. So if all of your or most of your claims are being denied because the front desk didn't check eligibility and verify the benefits, then you can't blame them for that. You need to train them on it. You need to quiz them on. You need to let them know why it is important that you do eligibility every single visit, why it's important that you check the benefits of the patient, especially if you're in a specialty that requires certain things like authorizations and pre-op, pre-certs, all those things. That is the practice's duty to do. So you can't blame the front desk if they don't know how to do that. You don't just put people in a place and expect them to know what to do. You have to show them what to do, and you have to show them how to do it the way you want it to be done. Okay, do you have a lot of medical billing clients? No, I don't. I wouldn't say a lot, and I'm not trying to get a lot at this point, because like you said, working a 9 to 5 and working business as well can be difficult. And the more you get, of course, the more time it's going to take for you to do the billing, follow up, do all of those things. So presently, no, I do not. I have 3 clients at this time, and I'm good with that. When I'm ready to say, maybe go out full time, or, if I decide, and I don't know when that's going to be. It's not going to probably be tomorrow. We'll see. I don't know what life is going to bring. But when that time comes, I'll decide. So I kind of base my how much clients I take on. Now, I have so many different things as well too, because again, I do my remote one-on-ones. I do this YouTube channel. I have my billing business. I also do credentialing for Virgin Islands doctors, and I do some consulting for Virgin Islands doctors. So I have a lot going on in my 9 to 5. So that takes up the bulk of my time. So I'm not going to try and take on 20 clients and not be able to handle them. Also, my other reason for that too is that I just started using a new practice management system, and I want to get acclimated in that practice management system, make sure that I know what to do, how to deal with all the claims and all the nuances of that. And then I'll decide whether or not I can take on another small client or a client with more providers, whatever the situation is. So right now I have, like I said, 3, and I'm good with that, because I'm really not trying to run myself that ragged at all. Really not trying to do that. Okay, so if you guys don't have any more questions, be sure to like my YouTube channel. It's called Medical Billing Maven. Again, I also sell medical billing merchandise. It's on itsallmedicalbilling.com. You can click on the shop, and then I do remote one-on-ones also on itsallmedicalbilling.com, and you can go under consultations. So if you don't have any more questions, we're hitting that 1 hour mark, and I'm so glad that you guys joined me today. I don't know if Fridays is going to be the day. I'm trying to try out different times, different days. So let me know if you have any suggestions on times and days. I was doing Saturdays at 6, then I was doing Saturdays at 2. But I'm trying to find what's the best time that people are actually going to be on, because when I do these lives and when I take out the time to do these lives, I want to be able to engage with you guys, talk like how we've been talking, help you with any questions, do all of those things. I want to be able for it to be worth the hour that I'm on here and not just be here talking to myself and, if it's not important. I also am thinking about, now I usually try to do my lives once a month. I usually was doing it on YouTube, Facebook, and LinkedIn. Instagram, I'm trying this thing with you guys, but I don't know how I feel about having to look into 2 different screens. Like I like to, when I'm talking to somebody, I want to talk to them and look at them. And I kind of feel funny kind of going back and forth. I don't want to make one person or one set of people feel like I'm not talking to them in the next. So I don't know. Instagram doesn't want to play nice when it comes to StreamYard. So this is why I have to do it this way. But I said, let me try it. But I try and do my lives once a month. On YouTube, I usually put out at least a video a week. And my next live, I'm really thinking about doing it on when you're getting clients, what questions you should ask them. Because just the same way that you go into an interview to become a biller, or you are trying to get a client as a biller, you need to ask that client questions. You don't just, somebody gave me, somebody needs a biller and they gave me the billing opportunity, and you just run with it and have no idea what's going on. And don't get me wrong, I'm doing this, or I want to do this because I have done this several times. We're so excited to have a new client. We're so excited to, you know, finally get somebody to let us bill. And we don't ask them any questions. And then when we get to billing for them, it's a disaster and we're miserable. So I really think my next live is going to be about that. And that will most likely be in March, because I can't believe we're in February, but that might be in March. I'm going on a tangent, but that might be in March, or I might just do a second one in February, depending on how I feel. It might be later on in the month. I might do about that. So if y'all are interested in that, let me know. And I will see you guys in my next live. Check me out on YouTube. If you're not on there already, subscribe, like the video. I'm on my way to, you know, hopefully helping lots of people who want to learn more about medical billing. So please share this video with anybody that you think will benefit from it. And I will see you guys in my next live. So make sure you join me. Have a good weekend. And happy Black History Month. Can't forget that. Happy Black History Month.